All right, Miss Lauren. As I said before, we're going to talk about you, and there's a lot of interesting things about you. But first, thank you for being here.
Of course, I'm so glad to be here.
So, what your cellular biology is
Yep.
one? Okay, you got to take me through that because I saw that and I was like, okay, this isn't common for me to meet someone who has studied this. Where did this idea of wanting to do this come from?
So I think that maybe from the time I was like 7 or 8 years old, I knew that I was put here to be a doctor, but couldn't really figure out what kind of doctor I wanted to be. Definitely an MD, the distinction between MD, PhD. That's always kind of been my route. But when I got to college, I realized how much I thankfully love science because the pre-med track is nothing but hard science. There's
Yeah.
biology, chemistry, OChem, physics, all the things. But then within biology, I realized that with all the classes I was going to be taking in medical school anyways, a lot of the cell biology track was pretty synonymous. And so taking histology, which is microscopic anatomy, anatomy and physiology, micro, um, what else? Embryology, genetics, all the things. And immunology was probably one of my favorites. But so realizing that kind of taking all these classes could somewhat give me a better understanding of my path, that kind of led me to that. And then I ended up doing research in a lab with human cytokine cells. And we were looking for a new drug target for flesh eating parasites. And
Wow.
so I
Jeez.
loved it. And so it's been very interesting to connect the dots between psychedelic research and clinical applications, being someone who comes from a science background.
Okay, so how did you start making the link between psychedelics and this? Because it's interesting. There's a large, as I talked to Jennifer Montjoy about this, who researches this, there's a large spiritual component to psychedelics, but then you're talking about the science aspect. How did these merge together for you?
So hopefully no one on the committee interviewing me for med school watches this, but I don't care if they do.
You know what? They
They
need to
either take
watch
me or they
this.
don't.
Come on.
Um, so my first time ever doing a psychedelic was at a Phish concert. I don't know if you've
That's
heard of Phish.
amazing. Of course, I know fishes.
So I'm one of those crazy people who you see in all the pictures front row in the same spot every single show. And it's about 250 to 300 people that are the same people at every show and are crazy like me and wait in line. Like we have tickets, but we wait in line for like 4 hours before the show to get wristbands to get in early to have our spot. So I'm one of those weirdos. But before I became one of those weirdos, I went to my first concert in 2016 and I tried LSD.
Yeah.
And little did I know everything that was going to happen from that. I just remember, I feel like I often think about the first time I did it and the feeling that I got, and realizing that, some people have church and I have fish, but not just fish, but music as a whole. And like that's kind of where I go to like sort things out internally, do psychedelics, and have my own meditation. Like that is my way to kind of like feel right and balanced with all the craziness and chaos that is life. And so I did some acid, realized that my entire consciousness had just been, burst wide open.
No doubt.
And then at the time, I was already working in medical marijuana in Colorado, treating patients who came in with varying conditions from insomnia, depression, cancer, chronic inflammatory autoimmune disorders. And so the shift was already about to happen. I think about a year after that is when it really started shifting for me, was going to cannabis conferences and seeing all the big players who are realizing, for the wrong reasons, for money, why they should switch from cannabis to psychedelics. And so that happened in probably 2017. And then I kind of started thinking more about, ketamine clinics and what is ketamine and what is this about? And noticing that they were slowly starting to kind of like pop up around the country. And so for me, doing psychedelics at Phish, realizing that I had my own connection to it, working in cannabis, seeing the shift with psychedelics, and then kind of starting to figure out where I could fit into that and opening my first clinic with my ex-partner, and that was in Colorado. And then we started doing retreats, and then we would go to California or New York, and then do more and more and more. And yeah.
You know what's funny about this story is the first part, especially. I hope no one watches this. This is a whole thing, right? We got to talk about this whole stigma and
I
stuff.
know it's a whole thing. I feel like I know so many people who go to medical school and they're like, what if I have a tattoo showing? What if I have, dreadlocks? What if I have whatever? What if I have my life that is, eccentric to some people out in the open? Am I going to be denied acceptance? Am I going to
Yeah,
be denied residency? And it's terrible. And I feel like it disproportionately affects women because we go back to like the oppression of women and
sure,
just people in general, and white men being in power and across all industries from what I've
sure.
seen, cannabis, psychedelics, healthcare in general. But yeah, so coming from a background of science and doing research on human inflammation and then kind of doing psychedelics and then treating patients, all of it was just kind of pushing me further along on my journey, which
Yeah,
to me now it's been made very evident that the universe has told me that yes, I'm going to be a doctor, I'm going to be an MD, but not traditionally. I'm going to do,
yeah.
integrative preventative healthcare, focusing on women's health, and just honestly interweaving all of the important modalities that are near and dear to me, which are cannabis, psychedelics, and just holistic integrative approaches.
Yeah, I'm totally with you. It's so funny. Like we do this to ourselves as people because of this conditioning that this is bad. And society has said this is bad. So, like, man, I hope no one knows I'm doing this type of thing. And that's part of my whole thing is like why I reached out to you and a bunch of other people because we need to platform psychedelics and all these different things. Like, this is not bad. Okay. You've gotten wrong information about this.
No, yeah. When I disclosed to my sister wrongly years ago, I was like, yeah, I went to this concert and I tried acid.
Yeah.
She was like, oh my God, you're gonna melt your brain. We have to get you into rehab. We need to have an intervention.
Come
And I was
on.
like, no, like, I'm not like doing, crack in the alley. Like this is
No.
totally okay. And so I think it's taken a long time for my family to come around to the fact that I am the black sheep, and like in the best way.
In the best
And
way.
my friends and everyone else. And I feel like through the years of working across these industries has really helped me, outwardly express who I am, what I do, the type of medicine I want to practice, and all that good stuff. But yeah, there's definitely still a stigma, but I think that with more and more people, getting conferences together, more and more people doing documentaries, the fact that How to Change Your Mind, I feel like has turned so many people on to
Huge.
psychedelics that it's crazy and it's great. But at the same time, I have a lot of kind of like disappointment in some of the people that are going towards psychedelics for the wrong reasons. And I've encountered way more than my fair share of them working in
Really?
this industry. And it's pretty jarring, like if you can actually pierce through the veil and go to the inner circle of the biggest companies that are publicly traded. They've got 120 million seed for their startup, and all these people, and the majority of them are not clinicians. They're usually not women. Like there's really no like representation. There's white men, they're usually ex Wall Street, and they're in it to line their pockets, and they don't really
Yeah.
care about clinical oversight or safety or standardization of patient care. And how are we going to do this for the greater good of healing people, but rather how are we going to get the most people in the door with the lowest cost and keep the volume up. And it's just about the turnaround and how they can keep, increasing the profit margins from what I've seen from a lot of
Well,
people.
see, this is why people like yourself need to be doing this type of stuff. You need to be speaking on podcasts as much as possible or different media, the clinicians, the researchers, because the people who have all this money, the angel investors and stuff, once something hits a critical point where it becomes like, oh, this is viable, this is going to be big, then they try to take over that industry for that. So I'm really happy that you're willing to speak about it, even though I guess there may be some little risk. Like,
Yeah. Eh.
you know, I know you just, you know what? It's a short life. It really is. I was just telling somebody today, is like, you got things you want to do, you better do them, man. You
No,
better
I
do them.
know. I know. And for me, it took a while, with cannabis and feeling like, all the taboo around that. And then
Yeah.
with psychedelics, I try and be very careful about, ketamine is the only legal psychedelic. I
Right.
know I already listened to the podcast earlier today, actually, with
Yeah.
Dr. Jennifer that you guys did, just to
Great,
kind of
man.
see what you guys talked about. And very much, down to the science of it and kind of the
Mhm.
protocols. And so I feel like for me, knowing that it's legal, like I feel very comfortable like shouting it from the rooftops. And my
Sure.
only hesitancy is like, delving into all of my experience with the other psychedelics that are not
Sure.
legal.
Yeah.
But I don't know, I'm kind of feeling like it is what it is. So
It
whoever's
is
going
what
to
it
hear
is.
it's going to hear it. And I'm hoping that
Yeah.
maybe my experience can help some other people.
Oh, it's definitely going to help some other people. I mean, my psychedelic experiences have had a huge cascading effect with all many people in my lives who have been turned on to it and have realized they've had the wrong information for that.
Yeah.
There's some courage in it, like you getting out there saying it. But I want to ask you a similar thing that I'm thinking about it with Dr. Jennifer Montjoy. She talked about, and you listened to about how clinicians are often discouraged from having experiences
Actually, I made a
themselves.
note. I made a note
Did you?
when listening to that because I was like, oh, I actually want to address that
I want to
because
talk to you about that.
so it used to be in Colorado that nurses, doctors, medical professionals across the board were able to obtain a medical marijuana card.
Okay.
And in Colorado, it varies state by state because of it not being federally legal across the board. So each state has to create their own entity to essentially kind of delve into what are our rules, what are our regulations. Excuse me. And so for Colorado, it's typically, chronic pain, and that can be a plethora of different things. So chronic pain is just an umbrella. And then there's cancer, there's autism, there's PTSD, whether it's combat or non-combat related. And so the one thing about Colorado that I never understand is that mental health is not a qualifying condition besides PTSD.
Yeah.
So, yeah, depression and anxiety would be the number one thing that people would come and say, this is what I have. Also, insomnia. Number three, one, two, and three, every time across the boards, people come in and they say, this is what I've got, dealing with. I'm like, I understand and it can help you for sure, but legally, I can't put down on the state's website that you're coming in for depression, anxiety, or insomnia. And then in other states, it's covered. And so medical professionals were able to get that. And up until about, I want to say 2017 or 2018, the state were just kind of like, no more. And so it's just, I don't understand it. And I think it's just the continuation of doctors and healthcare workers are not supposed to have anything wrong with us. We're supposed to be the ones that like have it together. We like compartmentalize everything from all of the patients we see, and we're just a container and a vessel to hold all of it. We should just be fine. But that's just not the case. Like
No.
mental health and the stigma with that is very similar with cannabis and psychedelics, and all of it for me is intertwined. Like I always try and recommend cannabis, whether it's low dose THC or CBD, to see if it'll help someone, and ask about their psychedelic experience and ask about their interpersonal relationships and where their mental status is at the moment, because all of it is interrelated. And so when Colorado got rid of medical marijuana for doctors, it was really frustrating. But I was like, you know what? It's pretty on brand. I could see them doing that. And so I think that it just comes along with the idea of providers having to be the ones that have it all together. And there's a really great psychiatrist that I'm connected with who's really like kind of getting the word out there about, you know what, I'm a psychiatrist and I take antidepressants and it's okay, because it's a matter of like reapplying for your license and all of your boards to essentially say like, I'm good, I'm fit to practice, because if not, and if I'm broken, I can't treat patients.
Yeah.
Obviously, if I'm dealing with something, how can I help my patients? But that's not the right
It's
way to think
crazy
of it.
stuff to me.
And so it's a whole thing about, HIPAA. Like you don't have to disclose that you're taking an SSRI. You don't
Right.
have to disclose that you did ketamine. a ketamine treatment or whatever. But everyone assumes, you need to disclose that. But I think that, I've probably treated as many practitioners as patients as I have patients. And
Wow.
so I feel like I really thoroughly enjoy treating them. I mean, I love treating all patients, but specifically practitioners or doctors or NPs or PAs who are wanting to get into ketamine therapy. And they're like, I've never had an experience, but I was diagnosed with cancer. I went through a traumatic car accident. I've had treatment resistant depression for 20 years. Like every one of us going through the pandemic, we all have depression, we all have anxiety, we all have trauma, even if it's like a micro amount, because I always assume it's a little bit of like a spectrum. And
Right.
so being able to treat them and have their eyes opened to this medicine and how it can really transform the lives of their patients is so rewarding. And I feel like, getting away from the fact that yes, there is a stigma with getting mental health treatment at all. It's just like if you were going to be taking an SSRI and not disclosing that to your board. And so I do agree that there's a stigma with it, but I feel like I've treated so many doctors and other practitioners that it's just kind of like it's all right. Just do the
Yeah.
treatment, do what you got to do for yourself and your mental health, and it just is what it is.
What also seems like, and rightfully so, I want to put a disclaimer on this, is rightfully so to focus on people who are suffering from chronic conditions. But I also like what Michael Pollan said. Also, it's about usage of these things for well people. I mean, who knows what that means completely? I mean, we all have some things going on, but like, you may want to call it the recreational aspect of it. And I feel like that also is even more stigmatized because it's like, oh, why are you doing this? You're fine. Like, like we can't enlighten ourselves even if we feel like we have a lot of things together. Like that's the area I think is weird. It's like you're put down because you're trying something that just enhances your life. But oh no, no, this should only be for people who have chronic conditions, you know.
So, for me, I try and explain to people the way that, I envision my clinics and my own practice and just how I go about treating patients. And it's not the Western model of you wait until you're literally like in pieces falling apart. And then we as doctors just kind of like duct tape you back together and just
Yeah.
kind of like maybe slightly put the pieces back. But like, why wouldn't we rather just have a society of people who are healthy continue to be healthy, stay healthy instead of the pieces falling apart? Why don't we just stay healthy and stay upright, instead of like waiting until we fall apart and then, shit's hitting the fan and then we
Yeah.
have to kind of like fix it. And so I think that goes along with the same line of this is the Western model of healthcare is that you don't do anything until you're absolutely, until you've got stage 4 cancer. You
Right.
don't do any preventative. It's like you're
Yeah.
on the operating table is whenever you start looking at changing your behaviors or your patterns or your lifestyle or your health. And so I definitely think that needs to shift, but one of the big obstacles, and I don't know if you and Jennifer talked about this or someone else, is that for someone to be approved for ketamine therapy, you have to do a medical eval, a medical intake, which essentially makes sure that you don't have cardiovascular disease,
Of
you don't
course.
have high blood pressure that's untreated, or a thyroid disorder, which would then affect your blood pressure because this medicine will increase your heart rate, increase your blood pressure.
Right.
The last thing we need is someone to stroke out when they're doing a treatment. On top of that, you got to look for active suicidality, mania, psychosis. You have to look at all potential risk factors and make sure that people are stable before going into this treatment. Just like you wouldn't be giving cannabis, high doses to someone who is bipolar and could accidentally throw themselves into mania or psychosis.
Yeah.
And so it, yeah, it's hard because you have to have a condition that is approved
Mm.
to be doing this. So it's kind of hard. It's like, yes, we can give it to you when you're well and you just want to be a little more well, but you still have to qualify because even though I agree that it is amazing to do this and be even better and have a transcendent experience and improve your spirituality and your emotional health or doing couples therapy and improving your marriage,
Right.
But in order to get it, it's just like any other prescription. You wouldn't be, given Xanax by your doctor just because you're okay, but you want to be a little better. So it's like you have to have, depression, anxiety, trauma to be able to move forward. And I guess it's just kind of like, it's just kind of how the DEA has structured
Yeah,
it, because even though it's a Schedule 3 controlled medication, it's not, as high on the list as like Adderall, for instance. It's still something that has to be prescribed by a medical professional. And so even though it's like two sides of the coin, like, yes, I agree that we need to be able to do this and be even better and keep ourselves well and have a better outlook on life, but it's still a medical treatment and has to be done in a very safe container
of
medically
course.
for the health and well-being of the patient for safety.
Do you feel like your experience at the Phish concert and different things is just doing LSD has helped you become a better clinician? Or
110%. Because
okay.
here's my thing. So I don't drink. It's not like I feel like whenever I tell people that, they assume I'm like a recovering alcoholic.
Uh-huh.
I just feel like alcohol and me are just not friends.
Sure.
And I also have really bad acid reflux. And so, like,
Mm.
spicy foods, alcohol,
Yeah.
coffee, all
You're
three of
just
those.
listening to what works and doesn't work for you. I mean, that's all it
Exactly. And
is.
so I also just feel like I've gone to so many concerts and I've just been out and about in the world that I've seen so many people be just grotesquely
Yeah.
over intoxicated
Yeah.
with
Yeah.
alcohol that it just, I'm like, maybe I could go to brunch and have a mimosa with some
Sure.
friends or get a margarita with some tacos, but I'm not someone who goes to a concert to just have a space to get drunk,
No.
and guzzle Bud Lights or whatever people do
No
at concerts.
way.
And
No way.
so I have had the very great pleasure of meeting some of my closest friends at these concerts because we're on the same wavelength in terms of we like to go. We don't talk during the show at all. We talk
Mhm.
after. We hang out in our pajamas after the show and have takeout. But during the show, none of us drink alcohol. We're always, in our little group and we have our space and we all do copious amounts of psychedelics.
Yeah, this is great.
And it's always a running joke between my friend Carrie and I that I could take a 10 strip of acid and take a driving test
Yeah.
because some people, can take half a hit or, let's just talk about the context of psilocybin or MDMA and
Right.
they're just, through the roof. And
Yeah.
for me, I have a much higher tolerance for
I
psychedelics and
see.
it's the opposite with cannabis. Like I do like 2.5 milligrams of THC in an
Yeah.
edible and that's like, it'll put me out for 8
Are you
hours.
serious?
Yeah, but that's what I do
Wow.
for my bedtime routine. I do that
Okay.
and 2.5 of CBD, CBN, and 2 milligrams of melatonin, as well as like almost 300 milligrams of magnesium
I
glycinate
mean,
and
you're like the
L-arginine.
best. You know that, Lauren. This is like we are like connected here.
I'm
I
so
mean,
glad. Yes.
we're like the best. I'm a
um,
big cannabis person. I don't care what people think, man. I live in Washington State. It's
I know.
recreation legal.
I
And
actually have a cannabis cart next to my desk. So
oh,
like
really?
most people have a bar cart, but I have a cannabis cart
It's
with my
great.
like 6 different strains with my containers that are color coded and
Yeah.
all my different little gadgets. Um but so all of my friends and I we enjoy doing psychedelics. We don't talk, we don't drink, and we just
Yeah.
go for the music. And it
Yeah.
just feels like I can't even really put it into words, but that's why I kind of liken it to going to church for some people
Mhm.
because the amount of it's just like the energy that the crowd has that like we're giving to the band is bouncing back at us and it's just like reverberating and everyone just kind of feels like on the same wavelength and it's
Yeah.
just this massive sense of community and it just feels like this very safe container except for the people who stumble in shirtless and drunk. We don't like
Sure.
them.
Sure. Yeah.
But going there for me, everyone always thinks I'm crazy when I say this. Everyone's like, "Oh, I've never done this." Whenever I do psychedelics and I go to these concerts, I am kind of just like in my head thinking about planning out the next 6 months of my life or looking at the last few months of like, this is what I've been doing.
Yeah.
These are my goals. This is like my internal like filing cabinet of how are my friends? Like, do I need to check on them? How's my family? Like, do I have something to do? Do I have a meeting? And like just trying to like
Wow.
organize my life. And it just feels very like I just feel very balanced when I
Yeah.
leave. And I know that most people don't do that. But for me, even
No.
though that's technically, I know, I know. Very type A. And so I think that's another reason why it takes such a high dose to really like, send me off the
Yeah.
cliff because I'm just
Yeah.
there's so much control.
Yeah.
And so for me, I just feel, very balanced when I leave these experiences. And I feel like even though it's technically a recreational setting,
Of course.
it doesn't have to be. It can be, your own spiritual medical setting internal. And that's the same that I tell my cannabis patients is that, yes, this is a recreational dispensary. This is a medical dispensary.
Yes.
It's up to you on how you want to use this and have cannabis be your plant, your medicine, and use it therapeutically. Even though it says recreational, let me give you a little secret. It's the same shit.
Of
Okay.
course.
Like if you're growing for rec and you're growing for med, it's going to be the same products, but I mean, pretty much, when it comes to flower. And so definitely the edibles are generally going to have much higher THC content.
No doubt.
It's usually the same companies that are making it. It's all the same stuff. And so
Yeah.
it's just all about, I think, how you internally go about the experience and that it can be recreational and you can, take it and go party and go to a club.
Yeah.
Or you can also do that and it still be, very spiritual for you. But I
True.
think it's just kind of up to the individual.
I think so too. I mean, for me, it's definitely just more of like, I tend to be a very serious person, and it just helps me be more relaxed as a human, like not take things so serious. I don't know, maybe I think it makes sense to me. Like meditation's not my thing. These other things, not, I think that's what we do. Like in wellness, is we go, oh, why don't you just meditate more, or why don't you do this? That doesn't work for everyone. There's different ways to get to a similar place, and for me, every Friday is a very sacred time. I love edibles. I'm a big edible guy. It's very psychedelic to me a little bit. It has a
It
little
can
bit of,
be.
it has some of those qualities. And I like being in there 3, 4 hours. And honestly, I'm gonna be honest, I love the munchies. I love that aspect too,
Yeah,
man. I enjoy
it's
eating my
great.
favorite snacks and stuff. I'm telling you,
No,
it's
it's
amazing.
it's honestly the best feeling ever. It's like after a
Amazing.
long day, you come home and you're like, "You know what? I wanna have a bubble bath. I wanna smoke a fat joint or take this
Yeah.
edible. I'm gonna, like, put on my favorite movie. I'm just gonna have, like, my dimmed lighting, which is good for
Yes.
your circadian rhythms, and I'm gonna have some snacks." And, like, that is something that I
Yes.
crave after, like, a long day, so I get it,
Yes. We're
and
just the same people with
yes.
this, man. It's like,
Yeah,
I'm not gonna lie though. When I watch a movie, the movie's going right through me, man.
yeah.
It's like right, I have to rewatch it every time. So I'm like, what
You
happened?
see, you have to be very strategic. In my book, I have like a category of like things I can watch when I'm high.
Okay,
And that
okay,
includes like Trailer Park Boys
okay,
or
okay.
let's see, Grand Designs, Great British Baking Show, something kind of funny and lighthearted, nothing that I
Right.
actually have to pay attention to.
That's my problem. I try to watch serious stuff, and it's
Don't
like,
don't do
yeah,
that.
it's a
Don't do
problem for
that.
me.
But
Yeah.
honestly, that's another thing that people don't think about is that cannabis at certain dosages for everyone whose metabolism, is unique, is a psychedelic. And
Yes.
I feel like every one of us knows someone who's gone into a dispensary or they've taken an edible and the bud tender who's the expert, which they're not the expert, I have trained
No.
them. They're
No.
not legally able to give you medical advice. And so they're just like, yeah, this 10 milligram is a pretty low dose. Like it'll get you blazed. And like that's their medical recommendation. And then someone who is like me, would like, 1 milligram or half a milligram to just be chill.
Yeah.
10 milligrams, I might be vomiting or tripping
Wow.
balls. Like you never know. And so that's
Yeah.
for me why I always err on the side of caution of no matter how old the person is or if they smoke already, having an edible, I don't care if you're like, oh no, I can handle it. I don't care. Listen to me, I'm the expert. We're starting
Yeah.
with half a milligram of
Yeah.
THC. We're going to journal, we're going to work your way up, and we're going to kind of figure out because the last thing we're going to have happen is you take this and all of a sudden it's accidentally 15 times how much you can really handle. And we have a situation where you're now like traumatized from
Yeah.
cannabis and it can't be something that you feel comfortable with as your plant. And then you never want to try it again.
Okay, I have a question for you with this. I'm a big 10 milligram guy. I love doing 10. It's like perfect for me. But I have noticed, depending on the type of edible I get, it can be a huge range in how I feel for that. What's the mechanism behind that? Why it can be so different?
So if you grab an edible and it doesn't say anything about sativa or indica or
Right,
strain
right.
specific, just like with a cartridge that you smoke, it's literally just they like isolate the molecule of THC
Yeah.
and then drop that into an edible versus if it's like they take the whole plant and it's very strain specific, you're getting all of the other cannabinoids, you're getting the terpenes, and you have the
Yeah.
benefit of the entourage effect. So for me, that's why I feel like there's a difference sometimes. But also, I feel like some companies are not always adept at making great edibles that across the board are always going to be 10. I mean, it's just like the whole like sunblock scandal. If you're into skincare, they're
Yeah.
like rated as being, 50, but then they tested it and it was actually like 15. And it's like,
Okay.
okay. So
That
I
makes a
feel like
lot of sense now.
I know, but then you think about back whenever it was first legalized, like in Colorado, like it's ridiculous, but apparently, you'd walk into the dispensary and there would just be Ziploc baggies because, Tyler from around the corner made some brownies and cut them up and put them in. And it's like, how do you know that his pouring was very even and it's not just 1,000 milligrams here and
Right.
five here? So yeah, I think that for the most part, there's a lot of companies that it feels very across the board and great, but I think it just depends on their extraction method, whole plant versus just, isolating the molecule and just kind of like what you typically go for.
How
Like for
can you
me,
get that information though? Like when you like I go to this, there's like 4 dispensaries in my town. How do I get that information to get like the exact one that I want? Like,
I mean, it's just, doing your due diligence and your research on fact checking the brand and if they
yeah.
seem to be, a good reputable source. I mean, for me, I really enjoy the company Wild.
Wild.
I love, love, love. My favorite ever is Kana. I don't know if they sell them with,
Kana's
where you
good.
guys live.
Yeah.
It tastes like cotton candy. It's these
Yeah.
little blue ones and it's their 1-to-1-to-1. So it's the whole thing is only 5 milligrams.
Yeah.
So I cut it in half. And I want to just eat the whole bag because it's so good.
Oh
But
my
it's
gosh.
just 5 milligrams of THC, CBD, CBN, and some melatonin. And those have always they've never failed me.
Yeah, Kiva's good too. I'm really into Kiva. It feels very high end. But it's very smooth. I like the body high. I'm very much into a body high. But see, here's the thing. It's like I can ask somebody at the dispensary. I mean, who knows what they know? I mean, they're
Just
just like,
don't ask them. Just ask me from now on.
I'm
Just
gonna ask,
call me and say,
I
I'm going
will.
to the dispensary. Tell me what to get.
Actually, I'm going to the dispensary tomorrow because I'm out of edibles. That's
Okay.
a
Well,
huge
where do you
tragedy.
go?
So when I
What's it
go,
called?
it's okay. It's called Birch Bay Buds.
Okay.
Okay. And it's a great place. But again,
Okay.
like I go there, there's so many edibles on this wall. Like, it's like gummies, there's chocolates, the whole thing. And I'm just like,
Mhm.
I, I just try a different one each time, a different bag. I'm just like, I don't know. I just got to check it
I
out.
mean, like, what are you using it for? So it's like, do you only take them on Friday nights and your
Yeah.
goal is to just kind of enjoy the high? Okay,
Yes.
so it's always kind of different depending on what you're looking for. I mean, if someone's here for, they have crazy pain, they have rheumatoid arthritis, and, they're needing to have a salve on their hands, they're
Yeah.
needing high CBD, they're needing, there's different needs, right? And each product can fill a different need. And so if you're just wanting, something that's for Friday nights and to have a nice little buzz, yeah, look and see if there's something that's got some CBN. Look and see if there's some
CBN.
CBD. I mean, honestly, my favorite flower is a very high CBD, low THC.
Mm,
So my favorite strain is Harlequin or Mango Haze, and they're
okay.
usually hovering between 4 and 6% THC. And
Okay.
those I can just smoke a full gram joint, which is
Yeah.
not something I do with really high, percentages. And I
Yeah.
can just enjoy feeling very relaxed because I always worry about being too high and getting like weird and paranoid and anxious because like I'm naturally an anxious,
Oh, I
paranoid, weird
see.
person as it is. And
Yeah.
so, yeah, I mean, look for something that is a strain specific, maybe,
Hmm.
and ask if they have a strain specific gummy or a chocolate that
Oh,
you can
okay.
use and other than just the molecule and see if you feel any different with that or see if they have some with CBD or CBN and see if you can add that in and try something new with that. You can
Okay.
also, pro tip, especially as it's getting cold, melt your chocolate into some hot chocolate. That's my favorite.
Whoa.
Yeah,
That
the
sounds
Coda
amazing.
Coda makes, I don't know if they have
Coda.
those. They're
Yes.
like
Yeah.
multi-state operator, but they have one that's a cream and crumble and it's almost like a like a cheesecake And there's almost like
Ooh.
little graham crumbles within the white chocolate. And I melt that into hot chocolate, make some popcorn, put on a movie.
Yeah. Is you just drop it into the hot chocolate
Hmm.
or what? Yeah.
Make sure it's like piping hot, and then you just, stir it in.
Stir it in. Yeah. Wow. That's the thing is I never worry about getting paranoid. I've never had that, but I've definitely felt like I wasn't in my body
Hmm.
and like I was like very disconnected from my body. And that was
So
weird actually.
there's actually a product that might be good for you. I spoke at a conference in 2019 in Mexico City called Cannabis Salud, and this woman that was speaking, we all ended up having dinner afterwards together, and she had a company called Undo, and it's not CBD, which I usually will recommend CBD for someone who is feeling too high because it kind of counteracts the
Yeah.
THC. And so, which is why I do everything with a mixture of CBD. And so, her product is not CBD, but it's something that can like turn off. It's like just like taking a benzo if you're
Sure.
tripping and you want to be not tripping. And so it's that, but for cannabis. And it also kind of helps give you a tolerance reset if you're wanting to
Mm.
do that. I feel like it's been many years since I've tried it, but yeah, you could check into that and just have that, in the bathroom cabinet if you're ever feeling too
Wow.
high.
I don't think I've ever felt too high. I'm like,
I know, I know, I know.
I don't know.
But
You know,
just,
you know what I
in
mean?
case.
Like it doesn't bother me if I'm too high, honestly. It's just kind of like I just accept it. I
You
just
see,
really
and that's me with psychedelics.
yeah. But I'm like that with
I'm
psychedelics too. I just accept
Yeah,
it.
I'm not that way with cannabis. Like I'll have, a vial of liquid LSD,
Oh,
and I'll be, wearing sunglasses as I do all the time, like
yeah.
inside at night.
Yeah.
And I'll have my dropper and I'll try and drop a few drops on my hand, and then I go and close the cap and I'm like, "Oh no. My hand is now covered. It leaked out of the cap." And I'm like, "All right, well,
Just
I might
accept
have
it.
just had 15 hits, but we're gonna let it roll and see how the night goes."
You know, you're definitely not getting into medical school after this conversation.
Just don't send it to them directly.
No, no, I don't even know who it is. Who cares? Like,
It's a school in the Caribbean,
oh,
and
okay.
because
You're
they have
in.
three different start dates, yeah, they literally don't care. And for me, I've always kind of compared myself to other people that I know from high school or from undergrad who
Okay.
are already in medical school or who are almost done or they're already graduated. And then I'm
Yeah.
like, you know what? Who knows if I would still be on the same path towards what I'm doing if I would have gone straight to medical school after undergrad, or if I didn't take an extra 2 years to finish undergrad because I was traveling around the world and doing this work. And who
Yeah.
knows, like different routes. But I am also a firm believer that I would have found my way here eventually, if maybe, taken me a few extra years. But I feel very blessed to have had the experience I've had with both sides of the spectrum in terms of socioeconomic status. Like where I grew up when I was a child, I was able to see firsthand how extreme poverty affects people in terms of it being cyclical and it being
Right.
so hard to get out of it and it being generational. And then I've also seen, like in New York, treating, the CEOs and the COOs and the founders and yada yada of all these massive publicly traded companies. And I've seen how the two live, and I've seen that the majority of people who are having access for ketamine treatments or are opening these clinics or companies or people who are profiting, same with the cannabis industry,
Right.
are not people who really should be the ones that it's going to. It's the people who are just the elite and then they just want to trip. And there's nothing wrong with tripping and expanding consciousness and being better than we are right now,
Of
just
course.
even by a little bit. But the people who are just struggling to even survive and get to the next day are the people that my heart is just pained like thinking about every day, and like that they are the people who need the medicine. And I actually forgot I was going to tell you about someone. I told her I was going to mention her. Robin Devine. She started the Black Psychedelic Equity Fund.
Oh,
And she's amazing. And she basically has just realized after having depression, after going through the pandemic and seeking out treatment, how underrepresented it is. I mean, I could probably count on one hand how many female Black psychedelic psychotherapists that I have met in the
of
space.
course.
And it's, I mean, it's just across the board. I feel like every new company I meet, every, conference I go to, it's just like, where's the representation?
Of
I mean,
course.
women in general, but just minorities. And then also you throw in a woman who is also a minority, and it's like, Jesus, like on top and on top and on top. It's just compounding that, like, more and more, it's just all I see is white men. And I'm just so sick of it.
I hear
And
this a lot.
I was so tired of building companies and opening clinics for narcissistic, egotistical, messiah complexed white men.
How do you really feel about this, Lauren?
I know, I know.
Like,
So so I feel like I've been trying to expand my network as much as possible this
yeah,
year of just women and underrepresented groups who are in the space who really need the treatment. And so my hope is, with world domination, I can create as much access as possible and education around health, and not just
yeah,
like, instead of us falling apart, but like, how can you stay healthy, be healthy, and create a better life for yourself and your children and generations to come through psychedelics or cannabis or
yeah.
your sexual health or overall integrative health and all the things.
It's interesting when I was looking for people to just chat with about, psychedelics, cannabis, all that stuff. It's just mostly white people, honestly.
Yeah. I know, I hate myself that I'm white some days. I'm like,
What?
"Damn it." It's like, I don't it's like, okay, I have the, being a woman that's going for me. At least I'm not a white man, and also, like, not a white man in my 40s, because I feel like that's typically the standard.
I
But
see.
I'm like, "I promise, like, I'm here to advocate for everyone." I'm like, "Ugh." But
Yeah.
yeah.
I'd love to be introduced to more. If you have connections to other, minorities in the space, especially psychedelic space, to have conversations with them, I think would be just enlightening. Um, and I know for me, it's done so much positive for my life. And I was one of these people probably back in my early 30s. I'm 44 now, who would have been like, "Oh, I'd never do that. These are bad drugs."
Mhm.
Like, it's just bad information. And
Yeah.
it's being socialized into something that you just didn't question. And right, it's like people will say, like, I enjoy a nice cocktail. For sure, I enjoy nice cocktail, but
Mhm.
like I I don't want to be like inebriated. I don't want to
Yeah.
be like, it's a weird feeling because it doesn't feel great. But when I'm high on Fridays, I feel amazing. And when I do
Exactly.
a 9-hour trip, I feel incredible. Like, I
Mhm.
feel like I learned something. And it's like, eh, you know, there's better options. And I want
Yeah.
the people to know that. I want them to experience that instead of drinking Natty Light, like
I
15 Natty Light. It's
know.
so weird to me,
It
actually.
is. It's
So
really weird.
strange.
It's very strange. I when I was driving home today from running an errand, I heard um, an advertisement for Drizzly, which is like an alcohol
Yeah, yeah.
delivery
Hmm.
service, and it was all about, like, get that alcohol before your parents bring the kid home, and I'm
Sure.
like, Jesus. Okay. Like, yeah, let's be completely lit when they come home and not be able to get them to bed or like give them a bath. But
Yeah.
I don't know. I mean, I think that there's a lot of people that I've tried to show the light with psychedelics and
Hmm.
cannabis, and so many people are so resistant. And I've honestly just, okay, all right, fine. You don't want to be, in the cool club of like doing things that
Cool,
are
cool.
better for you, and you just want to drink alcohol, do it. But I just don't want it around me. So I feel like
Yeah,
I've just done a great job with surrounding myself with other like-minded people who are on the same wavelength of personal growth and
yeah.
health and wellness and just taking care of themselves and not drinking. And it's very nice.
Well, what's
Be able
there
to meet
like?
those people.
What's the resistance? What's the initial resistance you get when you talk to people, just in all this phases of your work you're doing and all this?
I think it's mostly fear of the unknown, because
Okay,
like, they know how they're gonna feel if they take some tequila shots or drink a bottle of wine or
I see.
whatever.
I see.
But that's always the thing, is that doing the very first session with, a ketamine treatment for
Mhm.
someone, they're always so nervous of what's gonna happen. And, is it gonna be scary? Am I gonna have a bad trip? Like,
Yeah.
what is it? And so I just feel like, as much as I can, I try and just be a grounding force to alleviate as much of the anxiety and the unknown as I can, of like, look, this is fine. I'm right next to you the entire time.
Yeah.
We're going to give you a very low dose to start, because so many people, it's either they want to go really high or they're not sure. And I'm like, look, there is a standard here that we can follow. We do also kind of an interview of like, Have you used cannabis? Have you used other psychedelics? Okay, you've done acid. If your friends are doing, one hit or half a hit, what are you doing? Are you doing one? Are you doing 10? Because like that's a great indicator on what your
Sure.
dose is going to be for psychedelics, for ketamine. And people are always like, oh, I can eat 100 milligrams of THC. And I'm like, you know what?
Crazy.
There's actually no correlation at all. Being someone who does 2.5 milligrams, but my dosage for ketamine IM is like 140.
Hmm.
Um, like there's absolutely no correlation with
Right.
cannabis and ketamine, but for me, the indicator is always LSD. It just kind of
Interesting.
fits, with me. But
Yeah.
being able to ask that question and people say, well, I've only done it once. I only took half a hit and I was really high for like 12 hours. I'm like, okay, we're going to go very low.
Yeah.
or, or if I tell someone, okay, look, this is your body weight. This is your experience. This is what we're going to do. And then they're like, oh, it still kind of scares me. I'm like, okay, let's go down 10 or 15 milligrams. Fine. And then our next treatment, we can assess and we can go up from there. But just always erring on the side of caution and making
Yeah.
sure that the patient feels as good as possible, because the set and setting, which I know you've talked
Of
about with
course.
other people, it is so important.
Huge.
And going in with a very positive, relaxed mindset is so crucial. And I'm like, look, if you need to take another 10 minutes and you want to just chat some more, or you want to do some breathing or whatever, we can do that, because the important thing here is you and your path and your journey to healing. And the other thing about your conversation with Dr. Jennifer, for me, I feel like looking at the treatment itself as being equally important as the aftercare
The
and the
integration.
therapy.
Yeah.
I think that, like, don't even place the treatment itself as like this very, very important thing, because it is, but not looking at it with like the same lens of the Western model of care of like, this is a magic pill that you're going to take and everything is going to be fixed.
All right.
No, it's not. Let me tell you, even after 6 treatments, you're not going to be fixed. You're never going to be
Yeah.
fixed.
Right.
It's just learning how to deal with, cope, manage your symptoms of whatever you're going through, and just best approach and tackle the things ahead, that are life. But for me, it's like I always tell people, look, the treatment itself, this is not the end goal. The treatment is literally opening the door and giving you the space to begin healing, to really solidify whatever you worked through in that journey through therapy, and to continue integrating it into your life. Like the treatment itself, yes, it's going to be a wonderful, positive, hopefully powerful experience, but it's just the gateway to what's going to come next, which is the work. Like doing therapy
Yeah.
is putting in work as a patient, as a clinician, and this is just giving you the space to do that.
Yeah, most definitely. And I think also in that conversation, we talked about like the messengers and the messages. And I think you've talked a little bit about that with the people who are trying to invade the space for that. But I want to ask you the same question too, because I think it's a good question to ask again is like, what responsibility do you feel as a clinician to get out here and talk about this in the public
Yeah.
versus just talking to other academic people about it?
Yeah, well, so I feel like so I had a partner for many years and we got into this work together, and we have since split professionally and personally, and way, way, way for the better for me, mentally, because I really felt very much not like an even and equal partner. And I always kind of felt like, oh, I don't have my MD yet. What do I have to give? Like, I don't, I shouldn't speak up and be an expert on these things and advocate and be an activist for these things, because I don't have, 15 years of experience. I just have 8, or I don't have my MD yet. I'm not, and then it's like, okay, well, then what if you get to med school and it's like, well, I'm in med school, but I'm not through my residency or
Yeah.
whatever. There's always going to be something else. And realizing that there's so many people out there with so much to give, but also seeing that there are people out there with platforms that honestly shouldn't have one, because they give a
Hmm.
lot of misinformation
I see.
or they're in it for the money. And so for me, I feel very compelled to share my experience and talk to people who just baseline don't understand any of it, or they've had
Yeah.
some experience but just need a little help kind of like deciphering all of the information that's out there and the details and how it all works. And so for me, I feel like my upbringing and being able to see both sides of the spectrum of, poverty and billionaires and healthcare really going in people's favor, and healthcare not even being affordable for some, and like being able to be in both worlds and see both sides, and also going through my education, going through all the science, working with mental health, working with psychedelics, working with cannabis, and being able to see, almost 40,000 patients at this point,
A lot.
of how, I know I did the math,
It's a
it's a
lot.
lot. Um, that how their lives can be impacted and changed by not like me, as a future doctor and a dictator telling them, take this, do this, but like empowering people to take their own health and wellness into their own hands and realize that, you know, their doctor with a God complex telling them they have to do this, but then they don't answer their questions and they don't feel seen or heard. That's not the end all be all. That we as individuals have our own power to take care of ourselves and find information that's not just from one source. And so I just feel very compelled to do whatever I can to help as many people as I can across the industries and figure out how to interweave it all into one, and how to use that in my practice as a future doctor and now, and do whatever I can, up until medical school and hopefully still through it, to act as a consultant on these matters and help, improve quality of life for as many people as I can. And even, if it's a small thing, like I have a client who is a touring musician and I helped him fix his tennis elbow. And I was able to go to a concert that he was playing here in Austin a few weeks ago. And it was just very a beautiful moment for me to like watch him play the drums and him, thank me for helping enable him to do the thing he loves, which
Yeah.
is play the drums. And also how that can then affect the people that are touched by their music, and just like the rippling effect of how then they can tell other people about how they can take their health into their own hands, and
Yeah.
just spreading as much, useful information as possible.
I mean, you're definitely helping a lot of people. I mean, a lot of people, and you certainly have helped me
I'm
during
glad.
this, which I'm so grateful for. So tell everyone how they can connect with you and to learn
Yeah.
more.
Yeah. So my website is transcendence.consulting. And whether you're wanting to schedule an appointment for medical cannabis dosing, product recommendation, routes of administration, whatever for your condition, whether it's, cancer, insomnia, rheumatoid arthritis, whatever, there's that. I also do across the board integrative health consults, whether that's, including cannabis or not. There's also intimacy consults. So if you're someone who's struggling, with um, being in menopause, and you happen to be the owner of a vagina and you're experiencing dryness and vaginismus and pain,
Yeah.
painful sex with your partner, and you need help in, that department, as much as I can, I try and offer my services. And so transcendence.consulting, you can book sessions with me. If you're in Austin, we can maybe do it in person. Anywhere else around the world, we can do it virtually.
Perfect. Thank you so much, Lauren, for spending some time with me. I really appreciate it.
Of course. I'm so glad to be here. And please reach out anytime you need help looking for edibles.
We'll be talking about this in a second. All
Yes,
right.
we
All
will.
right. Lauren Nychay. Thank you, everyone.
Thank you so much.